Well said. Okay, now I have the privilege of inviting up Jared Martin, Stephen Chapman, and Kevin Scorpa. These are students from the first Robotarians First Robotics team, I believe somewhere in southwest Michigan, but I'm not sure which school. These are guests of Senator Pro's, and I think you'll find, the committee will find that they have some rather pertinent testimony related to the topic. Gentlemen, proceed when ready. Introduce yourselves as you speak, please.
Turn on that microphone right there.
Sorry. Okay. Hello, my name is Kevin Skrupa, and I've been a member of the team for 4 years.
Hello, my name is Stephen Chapman. I've been a member of this team for 3 years.
And hello, my name is Jared Martin. I have also been a member of this team for 3 years. As you know, we are here today representing the CW Tech Robotarians, which is a robotics team based out of Southwest Michigan, which involves high school students from Coloma, Watervliet, Michigan Lutheran, and Lake Michigan Catholic high schools, including some homeschool students as well. We would like to thank the committee for allowing us to speak in support of Senate Bill 411. Our team is involved with this bill because FIRST, which is our robotics, FIRST challenges teams like us to change the culture for the positive, which really means making a greater impact within our communities. One of our community outreach activities for the past year has been spreading awareness for a visual disorder known as Convergence Insufficiency. Some of you actually may remember a letter we sent out to all Michigan legislators and numerous Michigan government officials about CI.
Our team is here to support the bill that expands this early visual testing beyond the simple visual health issues, but to also include visual function issues as well. Specifically in this bill is convergence insufficiency. CI, convergence insufficiency, CI for short, statistically affects 8 to 13% of the population of the world. That means that 1 million people in the state of Michigan have this condition and might not even know it. From a more personal level, 10 classmates in my class at my school, Michigan Lutheran, and 10 classmates from Lake Michigan Catholic could potentially have this and not know it. 35 students from Watervliet High School and 50 students from Coloma High School may have this condition, but they have no idea. From a student's perspective, seeing our peers suffer through this and seeing the interactions between student and teacher struggling with education, we're right there to see it, and we can't help but feel sympathy for our fellow students as they struggle. Now, the AOA guidelines, which is in the handout that was given to you guys, is there to help doctors know the standard for the pediatric eye exam. Doctors or optometrists are expected to follow that when they give a child an eye exam. Now, unfortunately, students that don't have very obvious signs of these visual conditions, sometimes those tests aren't done simply because they aren't the highest priority. Now, I would like to ask you this. What do you think the impact of the diagnosis and treatment of CI would have on the academic and life success of students all across Michigan? It would be a great deal. Now, I would like to show you this, bring attention to this simulation we have of what a student could deal with when he's dealing with CI. Now, try to picture yourself as in the shoes of a 6 or 7 year old student who's trying to read and do his work and is struggling with this. The worst part about it is that they do not realize that this isn't normal. This is all they've ever known. 2 reactions that are common with students regarding this is a fight reaction and a flight reaction. In the fight reaction, you can observe students that try their hardest to work at it and they just struggle with it and they get headaches and they get really frustrated. Whereas on the flight reaction to this, you'll see students who decide that they want to avoid their homework because they're just too frustrated to keep going. Now, those reactions tend to lead to misdiagnosing children as having ADHD or dyslexic behaviors. And because of that, a lot of times they get improper treatment when the issue is a vision-based issue. So, the passage of this bill would not only increase test scores from students all across the state of Michigan, because they'll be better able to seize their opportunities in education, but it'll also open up the opportunity to change a student's life, one child at a time. I'd like to show you a quick demonstration of a simple test that was taught to us by a developmental optometrist that is local to us. Simply, what he taught us is you take an object like a pen or a small light or something, and you bring it in close to the patient's face, and they will tell you when they see double at the point. When they say that, you'll then bring it back out, and they will tell you when their eyes reconverge so that there's 1 point on the end. Now, if the patient reports seeing these occurrences at about 4 inches from the face, that's a sign that they don't have it. However, if they report seeing these occurrences outside of those parameters, further testing is recommended.
The CW Tech Robotarians were first introduced to Convergence Insufficiency when my brother Vince, there's a picture of him, he was diagnosed with it during his senior year. He had struggled for years academically. My parents sent him to Sylvan Learning Center, and all they could tell us was that he was a bright kid. They didn't see anything wrong with him, no learning disabilities of any sort, and he was up to par with all of his classmates. We also held him back his 5th grade year, and it was useless because it wasn't addressing the actual problem at hand. Excuse me. He was also tested for glasses in 3rd grade, and he's had glasses since then. He's been to an eye doctor 7 or 8 times, and they never found anything. My parents happened to stumble across an article on CI on Facebook, and they decided to have him tested for it. He was tested, diagnosed, and treated, and he made the honor roll for the first time in all his years of schooling, and he's working as a machinist at Edgewater Automation in St. Joe. Now, this was really hard on Vince to go through all of this because he would struggle with his schoolwork. He had headaches, dizziness, and it would physically hurt him. He tried to avoid it in any way he could. And my parents tried whatever they could to help him. They were gracious with him. They would slowly help him through his work, or at times they were really stern with him and would punish him for not getting it done. This held him out of things such as school sports and other extracurricular activities because he needed to get his homework done, but he couldn't. So I'd like to leave you with just kind of this thought that this is one story of many. There are approximately tens of thousands of families in the state of Michigan that could be going through exactly what my family has gone through, and not even, they could be going through exactly what my family's gone through, all the pain and suffering, and it's something that can be diagnosed and treated as early as 1st or 2nd grade. So, the CW Tech Robotarians, all 3 of us in our team, would love to thank you for the time you've given us today, and we're open to any questions you may have.
All right, fantastic job, gentlemen. Questions from the committee? How about praise from the committee? How about that?
Thank you.
Okay, gentlemen, thank you for your work, and good luck to you.
Thank you.